Hi, I'm Dr. Cath and today PD Insurance has invited me to talk to you about some research that Healthy Pets New Zealand funded. This research has had a really big impact here in New Zealand. It was funded a number of years ago now, and it was looking at hip dysplasia and how we were trying to detect hip dysplasia in dogs in New Zealand. Traditionally, we've done this by taking x-rays of dogs' hips, and we have them lying on their back with their legs stretched out. It's called the hip extended view. We've been doing this for over 20 years, along with most of the rest of the world. So what this research did was looked back over time and saw whether assessing these x-rays was making any difference across a number of common breeds in New Zealand to the hip dysplasia incidence rate. So we had 20 years of data. This research was undertaken by Dr. Andrew Worth at Massey University, and he had access to the New Zealand Veterinary Association hip dysplasia database. And the really scary thing that he found is that over 20 years, there was only one breed of dog that assessing the hips had made any difference to the breeding programs in reducing hip dysplasia over time. That's pretty shocking when you think we're submitting these animals to sedation and x-rays to try and assess a problem that at the end of the day we're having no impact on. So while it sounds like this research was a really negative outcome, the really positive thing that came out of it was that the New Zealand Veterinary Association sat down and had a long, hard look at why we were continuing with the scheme and made the decision that actually there was no point. It wasn't benefiting our dogs in New Zealand, it wasn't reducing the incidence of hip dysplasia, so we needed to make a change. So what that meant is that vets now recommend using the Pennhip method of assessing hip dysplasia. This still requires sedation, and it actually requires more x-rays. But instead of looking at the hips on x-ray with the legs extended, where at the end of the day the hips are in their tightest position, we're now assessing with x-rays where the dogs are on their backs, the legs are held in a normal standing position, and then we use a distractor to help push the hips out. There's nothing nasty about this. This is not going to damage your dog's hips. But what it allows us to assess is how much movement there is within those hip joints while the dogs are asleep. And from that, we can get a genuine assessment of how loose those hips are. We can then choose to breed from dogs that have better hips for the breed, so that over time we will see an improvement in, not so much an improvement in hip dysplasia, but we won't see hip dysplasia as commonly as we have in the past. Why is this important? Hip dysplasia leads to early arthritis onset in dogs. So this means dogs as young as 1 or 2 may actually be crippled and not able to run and jump and play like we would expect them to. That's not a healthy way to live. So that's what Healthy Pets is all about. It's funding research that's going to make a material difference to our Kiwi pets and help them live longer, happier, healthier lives.